To all of you, I'm Dr. Ketan Bhatyekar. A very happy yoga day. I would say yoga is not only about that day. Yoga is real yoga if you do it every day. So today we have got the best possible instructor from Goa who does not need any introduction when it comes to Goa, but when it comes to all over India, I need to know yoga मतलब asana ही नहीं है. Yoga is about understanding the medical part of the body. And I would introduce to you Sri Vinod Chimolkar, who is an expert at yoga, who has been taking varied classes at yoga, who deals when I get patients, I meet him, and through yoga, the best what we have done is healed people. We have made people flexible. We work together as a physio and as a yoga therapist, we work together. And there are a lot of diabetes cases where he has been handling it in a utmost excellent manner. People with sleep disorders, people with pain, people who want to have a complete flexibility and control over your mind and body, people who want to have a peaceful sleep, especially people who want to reach at a good level in life with good lung capacities, people who cycle, people who jump, they are into yoga, and I would introduce him as one who has been certified by the Ayush Ministry, who has been felicitated n number of times. His father was a freedom fighter, as well as he is there with Patanjali also. So welcome to this podcast today on the yoga day. I would request you to talk some things before starting the asana, and we would concentrate only on one or two asanas today to make people understand that without taking antibiotics or without taking any medicines or without taking any insulins, how we can deal the human body. But yes, we will concentrate today purely on sugar, diabetes. Person like me wants to eat a lot of good food, but then I have always a fear of pre and post sugar बढ़ जाएगा. So what do you think about it and how you would explain? We would like to know.
Okay. Thank you, Mr. Dr. Ketan Bhatyekar. As I know that today maximum people are suffering from the diabetes. See, whenever we are conducting the classes, we ask the patients or the participants, what is your sugar level? They are telling my sir, my sugar is fasting 220. Did you take any medicines? They are telling yes. Okay. So now we are conducting the classes for 1 week, 15 days or 1 month. And at the end of the session, your brother Dr. Ketan Bhatyekar, he was also there. He has to check the sugar level at the end of the session. And it's really a great thing that patient is so much happy without, no doubt you are taking the tablets, but doing the asanas. There are various asanas to recover the diabetes or to reduce the diabetes.
To reverse the diabetes.
Yeah. So after completing the session, we have checked a patient whose diabetes was 210, 220. We found at 110, 100. So this was the actual.
This is with medicines.
No, without medicine.
Without medicine.
So we have cured many people by giving a certain asanas. How to do the asanas? Even there is a special procedure for doing the asanas. While doing the asanas for bending, deep inhale or exhale, that is important. So while doing the asanas, breathing technique also they have to observe.
So can we just a 5 minutes or 10 minutes program today?
Yeah.
So can we only focus on today's how to help people reverse from diabetes using the yogic asanas?
Sure.
Can we?
Yeah.
So we start by within 5 counts.
Yes. This is the asana which is known as Bhadrasana. Okay? So you can sit in Bhadrasana for a second, 1 minute. Inhale it slowly, exhale it slowly. Be fresh. Then, now I will show you the Mandukasana, which is the best asana for the diabetic patient. But see that the asana which you are doing, it should be on empty stomach and empty bowel. It is better to do early in the morning at 5:30 6:30 or after lunch 6:30 or 7.
That's after evening, you said.
Or after evening.
Yeah.
Okay. So I will show the procedure. Sit straight, close your eyes, then bring the hands forward, close the thumbs and the fingers, take a long breath, exhale it completely. Then with both the thumbs, just press it near the navi, take a long breath, again exhale it, bend it. So the pressure should be on your pancreas. Here you have to take a normal breathing. Shape of this taken while coming out, again breathing and breathe out. Do it 2 to 3 times. Again I'll show you. You can stay in this position as per your capacity. You can do it, and at the final posture, you can stay at least 1 minute with the normal breathing. This is the best asana for the diabetic patient. Even I told earlier, while doing the asanas, see that your bowel and the stomach should be empty. Then you will get a good result. Then second I will show you the asana. Spread the thighs. Inhale it. Now which I will show it is a Shashakasana. Exhale it completely. Touch your head to the ground. Take a normal breath. In this asana, this is also benefit for your stress. A person suffering from stress or anxiety will get relief.
So,
coming up, take a breath in and do a normal breathing.
So this helps to relieve a lot of pain, stress and anxiety.
Yeah, sure.
Oh, the name of the asana?
Shashakasana.
Sashakasana. And the first one was?
Mandukasana.
Mandukasana. This both helps in reversing diabetes.
Diabetes, 100%.
Okay.
But see that he has to do it.
Yes.
Again, I am telling that while doing the asana, this asana should be done on empty stomach.
Okay, it should be done on empty stomach.
Empty stomach.
So what about people who can drink water before the asanas, or they cannot have water before the asanas? No, you cannot have.
You can drink it, no problem.
But in specific quantity.
Specific quantity.
Okay. So the question again, if you could repeat the first asana.
Yeah, sure.
Yeah.
Sit in Vajrasana, use a Vajrasana posture.
Yeah.
Then take a long breath. Exhale it completely. Put both the thumbs at the nadi side and bend it. While bending, see that you have to exhale it. And in this position, you can take a normal breath. So here you are giving the pressure on pancreas. While coming out, breathe in and take a normal breath. When there is a pressure on pancreas, definitely your insulin will get started and the sugar level will come in the normal position.
Okay. So this is one thing.
Yeah.
Now, when there is diabetes, there is a lot of pain in your legs. And there is a frequent urination. So there are people who have always asked me that what to do about your flexibility. There is a lot of stiffness in the body. This is irrespective of diabetes or not. So what would you suggest?
So there are some stretching exercises for the legs.
Yes.
But it is very difficult. While sitting also you can do it.
Yes.
I'll show you. Sit in this position.
Yeah.
See that your thigh and this should be touched to the ground.
Yes.
Look straight. This should be a 90 degree.
Yeah.
Right angle.
Mm-hmm.
Your both the hands should be spread and keep it on knee.
Mm-hmm.
Take a long breath. Then take the position. Again take the long breath. Now both the legs you can put it forward. Exhaling. Stay for a few seconds. 1, 2, 3, 4, 5. Bring it back. Breathe in. 1, 2, 3, 4, 5. Again, breathe out. Breathe in. Breathe out. Breathe in. So this procedure you can do it. So you will find that the back side of this nose,
Yes.
that will pull it out. And naturally, slowly your pain will be reduced. Even though you can rotate it like this 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. This is the exercise. If a person whose age is 20, 25, 30, you can stretch both the legs.
So another thing, I want to tell people about that age is not a factor when you do yoga.
Yeah, sure.
So can I know, if you don't mind, what's your age?
Right now my age is 63.
Yeah.
And now by December I will complete 64.
So before closing down,
yeah,
I want to just to inspire my young group as well as the aged ones that yoga can be done at any age. You can start at any age.
100%.
So could you show us the most difficult asana where you stand on your head or something like that?
Shirsasana.
Yes.
So Shirsasana is a very, we call it is the king of the asana.
Yes.
Shirsasana.
King of asanas.
So while doing this asana, any person you want to do the asana, see that you should be consult the doctor and check the pressure. A person suffering from the high BP should avoid these asanas. Okay? Then, if you want to try it, see that he cannot try it alone. There should be a perfect
So you need guidance.
and
Yeah.
perfect instructor. So that while doing, he can fall down. And
There are a lot of injuries previously, correct. Back injuries and head injuries have been seen in this.
I'll show you how to do the Shirsasana.
Yes.
So while doing the Shirsasana, see that your breathing should be normal.
Yeah.
Your eyes should be closed.
Okay.
Because while doing, all the blood from the legs, it will come down to the heart. And one more thing is the advantage that if any small blockages which is there in the artery or the veins, it gets the clear. Okay?
Yes.
So I'll show you the asana, that is Shirsasana. This is a Shirsasana.
Excellent. Excellent.
Your breathing should be normal. You have to close the eyes. If a person is doing Shirsasana, he can increase the timing. He can stay minimum 1 minute, maximum as per his capacity.
Mm-hmm.
While coming down, put one leg down, then sit in Vadrasana for a few seconds because the blood should come down.
And how many seconds you need to hold this?
Breathing?
Yeah.
No, in this case, you should not hold the breath. The breathing should be normal.
Mm-hmm. So can you just show it in this direction now?
Yeah.
At the age of 63, the father of asanas. Excellent.
Now my breathing is normal.
Yeah.
I can stay minimum 1 minute, maximum even 10 minutes also.
So what is the maximum time you have stood previously?
10 minutes.
10 minutes.
But I have to do early in the morning. So in this case, only benefit there, whatever if there is any hard blockage, it can be open. But a patient suffering from the high BP should be avoid these asanas.
Okay. Thank you, sir.
Then you can see
So we had an excellent time with sir. We would start off a series where he would come up with us and have small asanas. And I've been learning from him for past 6 months about going ahead of losing weights and getting my flexibility back. It would take me more 6 months, but I'm very thankful to sir because at this moment while coming, we went to the disaster management team, got the trees cut, and then came back today. He was there at NIT today to teach students. I would actually thank you, sir, for getting us to the reverse diabetes, and we would have programs on diabetes, to how to cure diabetes or how to reverse diabetes purely using yoga. And I'm thankful to you and thankful to all the viewers who have been there with us. And happy Yoga Day once more. Thank you.